Well, good evening, everyone, and thank you for coming to gather together on the topic of women's health. My name is Christina Lee, and I'm at Evergreen Physical Therapy, part of Integrated Rehabilitation Group. I'm a physical therapist, and I specialize in treatment of women's health concerns. About the past 20 years now. I actually started, I thought that I would be a hospital PT, ICU. I would always be hospital and ICU, and that's what I trained for. And I kind of came to women's health actually through my grandmother. Um, we were traveling, we were visiting family in Germany, and I always knew that she had to go to the bathroom a lot, but I never really understood what that meant. And then suddenly we were in another country, and you couldn't just pop into a McDonald's and go. You had to pay a bit solid every time that you use the bathroom. So that was kind of my introduction to women's health. And then I actually had my own bit of experience with with urinary urgency, actually being you know what you feel like when, gosh, I don't know where the bathroom is or where the next one's going to be, and then I move on, and I really could not stop and go to the bathroom. So that was my first experience with pelvic floor and bladder and how to calm that urgency down. So I wanted to ask everyone to please write in your questions as you think of them as we go, and we will try to answer as many as we can. So today, I wanted to go over and touch on a few different things today. First, pelvic anatomy and function. I get asked so often, not just like my pelvic floor muscles, where are they? And then what is a Kegel exactly? And how can I tell that I'm doing a contraction? I don't know what I'm doing because I can't see anything. And then also a bit about normal bladder function. For example, how many times a day is normal to go? And then what kind of time are you supposed to have in between each time you go? And then what about urinary control? How do I have more of that? Third thing, happier reproductive health, happier pelvis during pregnancy. Ways to help support your pelvis and minimize musculoskeletal discomfort through pregnancy. As well as a bit about abdominal muscles after pregnancy, how to bring those back. Pelvic pressure, and heaviness, for example, with exercise or with activity, and why we don't want to feel that, what we can do about it. And then a bit about bowel, like what is normal function, and then some tricks to minimize constipation and straining. All right, so this slide shows your pelvic muscles on the inside. And what I like about this slide is that right where the pointer is directing, you can really see, and this is a cutaway view of the pelvic floor, how those pelvic floor muscles make this nice sling of tissue between your pubic bone in the front and then your bone in the back. These are muscles that you cannot see, but you can feel them. So they support all three of your pelvic organ systems, as this shows urethra and bladder in front, vaginal canal and uterus in the middle, and then anus and rectum in the back. Okay, so people ask, what is a Kegel? What am I supposed to be doing? How do I know that I am using those muscles? So I'm going to stand up and also show you with my pelvic model. So this diagram that you're looking at on the slide is as if you were looking straight in to the pelvic floor. So this is the sacrum, or the posterior part of the pelvis. And then all of the red are your pelvic floor muscles, and they make a sling of tissue to your pubic bone in the front. So when you tighten these muscles, it should feel like that you are pulling up and in, like there is no way that you could pass gas or pee. So the easy way to be able to feel this, and I'm turning the pelvis around, is actually right here at your tailbone. So because all your muscles come in and attach right at the tailbone, this is actually, when you tighten these muscles, it's the only joint that moves. So when you tighten your muscles, your tailbone will pull in on average about 20 to 30 degrees. And when you relax, it will release back out. So let's all try to do one right now. It should not hurt to do one, and you should be able to feel at your tailbone. So take your hand, and if your hand is touching the surface that you are sitting on, then you are right over your tailbone. When you do a contract, it should feel like you are pulling up and in, like there's no way that you could pass gas or pee. And you should feel a little bit of tailbone pull in when you contract, and then tailbone release when you relax. All right. Now, what is normal? The average person in a 24-hour period will urinate around 6 to 8 times. So in theory, if that's 8 hours for sleep, that leaves 16 hours for the rest of the day, which means you are going around every 2 to 3 hours. That also means that you are taking in enough fluid that you are getting the urge to go around every 2 to 3 hours. So of course, if you drink more, yes, you're going to pee more, and if you drink less, yes, then you will pee less. The average bladder holds around 2 cups of fluid. Some more, some less, but generally speaking, around 2 cups of fluid. You help your bladder by having regular fluid in. So regular fluid in over the course of the day helps your bladder have regular fluid out over the course of the day. So if you chug a whole bunch of water or a whole bunch of fluid all at once, then sure, you're going to have to pee more often than every 2 to 3 hours. And again, if you don't drink anything at all, then yes, you're going to have urine that is going to be more concentrated, and it's going to look more concentrated as well. Now, fluids that we drink can really affect our bladder's desire to urinate or to get rid of that fluid. So fluids that are really stimulating to the bladder and make our bladder want to kick that fluid out sooner fluids that are caffeinated, so your coffee, tea, fluids that are carbonated. I've, had several people come in and say, sure, I drink water. I drink the fizzy water from Costco. And I really like that, and it really helps me, drink more, have more fluid in. It's not just plain water. However, fizzy water, the carbonation can be irritating to the lining of your bladder and make your bladder want to kick that fluid out sooner. So when I've asked people to quit their fizzy water, I can't tell you how often that folks have come back in a week or two and said, well, okay, it made a difference. So now I still have my fizzy water on occasion, but not like every day like I was having it before. So again, it's the carbonation or the caffeinated fluid that can really be stimulating to your bladder. Other things that are stimulating to bladder, acidic fluid. So, for example, like orange juice and coffee actually has quite a bit of acidity to it as well. So, one of the things that people have also found benefit from is looking for the low acid coffee. So, again, it's called low acid coffee, and it's in the supermarket. And I believe that Starbucks has a low acid coffee as well. This coffee town, so I can't tell people that they have to stop drinking their coffee. But you might try, again, a different level of acidity. You might also try changing a little bit the way that you take it in. So, for example, I'm going to have coffee, but instead of chugging it all at once, I'm going to try to have it over time. And if I have an 8-ounce cup of coffee, then I'm going to try to have a little bit, like 4 ounces of just water along with it. So a little bit before, a little bit after, to dilute what is going through your urinary system and make it less of an impact on your bladder. So carbonated, caffeinated, acidic can make our bladder feel more urgency to go. And urgency to go meaning, wow, I am really feeling the urge to go, and I'm just having, I really don't want to delay this very much. Or it can make us have more urinary frequency, meaning, gosh, I think I went 20 minutes ago, but wow, I really want to go again. And then the other thing that people can often feel is the stress urinary loss, meaning that when I cough or sneeze or laugh, lift, trampoline park, boy, lots of people tell me about the trampoline park, run, exercise at the gym. Those are things that can cause us to have some stress urinary loss. In therapy, we address this with working to strengthen your pelvic floor muscles and also working on urge control and urge delay. Strengthening your pelvic floor muscles might be doing just what we did earlier, that pull up and in, and then holding for, start with 3 seconds. And relax. And I usually say to try doing that. Might be 6 times in a row, might be 10 times in a row, but it should not hurt to do. And you should still be able to hold for 3 seconds when you're done doing them. So if you do 3 and you feel like, wow, my muscles are tired, just do 3. Do more later. Tips for happy pelvis. So relaxin hormone really it does a great job. It just gets started so early. So we get that first during pregnancy, your body gets that first push of relaxin hormone in the first trimester. And then our body spends the next second and third trimester absorbing that hormone. And it can lead to some pelvic discomfort with all of that adjusting. And specifically, the sacroiliac joint or the pubic symphysis joint. So again, here with my pelvis. So your sacroiliac joints in the back of the pelvis, between the sacrum and each hip bone, we call the ilium, right here and right here, or turning at the pubic symphysis here in the front, represented by the blue line. So pain in either of these spots is pelvis having a little too much shifting as body is adjusting to accommodate and get ready for delivery. In therapy, we work on some ways to offer support for your pelvis. Some ways to minimize straining of pelvic bones. For example, just some body mechanics with transitions. One of the things I talk about the most, I feel like, is doing a little bit of what I call warm up before you get up. So, for example, going from lying down to sitting up, that it will help if you warm up a little bit first, meaning lying on my side, but I'm going to do a little bit of, I'm going to wiggle my ankles, because even though you're wiggling your ankles, you are also working the muscles at your hip. I'm going to do a little bit of, I'm going to tighten my bum and do a squeeze on one side and then a squeeze on the other side. Because even though it doesn't seem like you're moving much, you are warming up those sacroiliac joints to make the larger, more dynamic motion and transition of going from lying down to sitting up a little easier on your pelvis. And then just activity pacing. So for example, maybe in past, you did 5 big box stores in one day, but really your body is working 24 hours a day growing this new life. So just some activity pacing and paying attention to how your pelvis is feeling. And when your pelvis is tired or sore after the second store, then okay, that's enough. Or in these days, maybe actually we're not going out to the store that often, but do I have to vacuum the whole house in one day? Can I pace myself a bit and do one floor and then do the other floor? Or do half and then, okay, take a break and then do the other half a little bit later. On this slide, I wanted to show that there are some different support things that have been really useful for folks. So on the left side is a sacroiliac belt, and there is a wide variety of these. I feel like I go to Amazon a lot these days, and for your SI belt, if you type in pregnancy belt, you'll get a world of different elastic and Velcro options. But they're all meant to go around the pelvis again, around the lower part of the hips to help give you a little bit of support, just like my rubber band is doing around this pelvis. So goes across the pubic bone and the lower part of the hips to help give your pelvis that support. You should feel like that it is giving you some support and even a bit of lift. It should not feel like squish. You should be able to, everyone asks, well, how tight should it be? And I always say that you should be able to get your finger in and not feel like that you're going to lose your circulation. So again, quite a variety of styles. Some are wider, some are more firm than others. I have a lot of folks who like to have two. So I'll have one for more heavier tasks and then one for lighter tasks. On the right side, kinesio tape. So taping to provide some support for pelvis and for belly as body is growing and changing. Pros and cons to each one. So tape has to be reapplied. It does not stay on forever, but it will usually last for at least 2 or 3 days. If you soak in the tub, yes, then it will come off. Tape does not move. Belt can shift a bit and tend to move. However, belt you can also take off when you're done with it, and tape is more of a take completely off and then reapply. I think it also depends on what time of year that it is. So I have family, my sister's in Hawaii, and she thought, forget it about the belt. There was just no way that was going to work. It was too hot. She shot me down on that one real quick. But tape was very doable. It was gave her some support and it was not as sweaty as the belt. So sometimes it also depends on what time of year it is as well. Okay. Now, after baby. Abdominal muscles after baby. So, if you notice, as is demonstrated on the left side, if you notice or feel tenting or bulging, please avoid doing sit-ups. And generally speaking, I say please avoid doing sit-ups until you are done breastfeeding. So our level of relaxin hormone is not as high as when we are pregnant, but it is still elevated as compared to when we are not breastfeeding. So it does not make it any easier for your abdominal muscles to come back together, and doing sit-ups is an exercise that puts quite a bit of strain and pressure on abdominal muscles. So tenting, as is seen on the left, is the abdominal muscle inability to stabilize as you're doing a head and upper shoulders lift. Picture on the right shows, oh, well, I'm not doing sit-ups, I'm doing bicycle legs, but really it's still putting that same abdominal strain. There are a world of other exercises that we can do. We can do that are not sit-ups. Planks, for example, or doing the Swiss ball, the exercise ball, dynamic balance, sitting on the ball, doing circles, going forward, back, side to side. But what I really want to emphasize is that you having your good form, no matter what exercise it is that you're doing. So people can sit on the ball and still have slumpy posture. It does not serve you so well. So with all of these exercises, you want to really be able to pull your belly button in towards your spine and bring your abdominal muscles together. So standing up, moving the camera a little bit here. So just like a jacket with a zipper, okay, I want to be able to bring my abdominal muscles together first. Just like a jacket, I want to bring the sides together first before I zip it up. And the same thing is true for abdominal muscles after baby. So physically bringing my sides together first and then pulling my belly button in toward my spine, and then doing whatever activity or exercise that you're wanting to do. So stabilization first and being able to hold that, and then adding motion. So in the beginning, it might just be, I'm bringing my sides together and pulling my belly button in, 1, 2, 3, 4, 5, and relax. And in the beginning, after baby, it might be just doing some of that. Maybe you do it 4 or 5 times and feel like, wow, okay, that really isolated my muscles. And I can feel that. They're tired. And that's okay. Just stop for now and then do some more later. Okay. So what we are trying to avoid is, again, abdominal separation or diastasis. So this goes in and out of, sometimes I feel like it gets a lot of press, or that it must have been on a talk show, because then I feel like I get a wave of people who come in and ask about it. So abdominal separation is what we are trying to avoid, and just bringing your muscles back together when we do have it. Separation makes for weakness, particularly feeling more back pain and weakness when we go to lift, whether that's lifting laundry or groceries or ever-growing baby, or whether it's lifting weights at the gym. But if we're having separation, we really want to try and bring some of that back together so that our muscles can be in this strong and together position versus apart and weak. So how much that people have their muscles come back together really depends. It can depend on, well, how did I have big brother or sister earlier, and did I have them recently? How much time did I have in between each kiddo? Some of it is also just the genetic hand that you get. Some people knit back together more, some people apart more. So if you are having apart and we get you to being close together and stable in this position, such that when you cough or sneeze, your muscles come in and stabilize versus apart, I think that's pretty good if things can stay together as you exert. Okay, so what we don't want to feel during exercise, pelvic pressure. And it can be exercise, but it can also be things like gardening, or what some people call gardening, and I think, gee, that's more like landscaping. Other heavy lifting, things like a lot of coughing or sneezing. So especially as we go into this season. Exercise that is impact, such as impact like trampoline, impact like big or deep squat down. We should not feel pelvic pressure or descent with exercise. If we do, then that is too much pressure on your pelvic organs and need to modify. Might modify by decreasing the amount of weight that you're lifting. Some people can also tell a difference different times of day that people can tell, oh, it makes a difference when I exercise in the morning, for example, versus at the end of the day when my body is often more tired from being up and doing more activity. I usually say that if you are going to do squats, for example, that you should tighten your muscle. I'm going to stand up again. That you should tighten your pelvic floor muscles first and then squat down, so that you are providing support and then initiating motion. And every once in a while, I have folks who feel like that they do better when they tighten once they're down into that squat. And if you feel like that you have more support, that's fine. Okay. So I wanted to talk a bit about bowel because I feel like so often people come in and might come in for one thing, or might come in for urinary trouble, and really there's more that is going on, but maybe that is not so often addressed. So first of all, bowel, like what is normal? Like what's normal for bowel movement? Some people can go 3 times a day. Some people can go 3 times a week. But what I often refer back to is to take a look at your stool. And some people might feel like, oh, that's terrible. But really, if you take a look at your stool, you're going to get a little better idea of what's going on with your body. So again, some people can go 3 times a day, some people can go 3 times a week. But if your stool is really difficult to eliminate and there's a lot of straining, or it looks like really hard, really firm, like little rocks almost, then that is really food that has turned into waste product going through your digestive system, but really staying in too long. And so our body continues to extract nutrients and fluid the longer that our food turning into waste products stays in our system, and then becomes more difficult and straining to eliminate. So I always say, well, the perfect poo is kind of like soft banana in terms of consistency and often in terms of volume. But it should not be a lot of effort to eliminate, and should not be a lot of straining, because like, it would be great if we could just press down or bear down on the bowel, but we don't. Our other pelvic organ systems also get that pressure. So the bladder gets that pressure of straining, and the vaginal canal and uterus also get that pressure of straining, which does not help everybody like stay where they're supposed to stay. So there is actually a term for what is going on now, and it is called quarantine constipation. So more people are having trouble with constipation during this time because our habits are so different now. People have altered schedules, people have different routines now, different family routines in the home. People are eating different foods. There's definitely more like comfort food that people are eating now. There is also decreased physical activity that a lot of folks are not able to do as much of right now, or not doing the way that they used to, as well as more stress and anxiety, all of which can lead to more difficulty with elimination. In therapy, we look at some ways to increase that activity, and specifically to give some exercises that help to encourage peristalsis, or movement through our system, as well as some changes in habit. For example, just like allowing yourself time to go, or well, for example, the routine might have been, I get up in the morning and here's my morning routine. I have coffee and then go and then off to work. But people's routines are a little different now, and a lot of folks are out of their normal sync, and just need to find some ways to put some of their routine back in. Bowel is very habitual and very territorial. So bowel is really used to being able to go like at time of day or location. Can also make a difference for folks. Okay, I always like this slide, and I've used this slide for a long time. I always thought that one was funny. Okay, last thing. Intimacy should not hurt. Sex should not be painful. Intimacy itself combats stress, the stress hormone cortisol. Intimacy also helps to boost our immune system with the hormones that are released during intimacy. So there's actually a higher level, for example, of immunoglobulin A after intimacy. There's also higher levels of oxytocin and dopamine and serotonin, all of which work to help reduce our stress levels. So intimacy should not hurt for a variety of reasons. I'm sorry, I meant to say that there can be a variety of reasons for why there can be pain with intimacy. And really the first stop with this would be your OB-GYN to kind of help determine what's going on and why we're having pain with intimacy. If it is a musculoskeletal condition or musculoskeletal concern for why we're having pain, there are stretches that we can do for pelvic muscles. And then I would just put in, I would also just put in or think about like, where is my brain? So if brain is over here and spinning, thinking about laundry and dishes and homework and teaching homework and work and family and all these things that our brain thinks about, that does not really help arousal level. So I always recommend to people arousal levels should be high, or in what I call 75% of the way or better, before we are adding friction and motion and pressure. So sometimes just have an urge to urinate, and sometimes just plain have urinary loss 3 or 4 times a month. And have had 4 live births and large children, 9+ pounds, and is describing having some bladder prolapse, and the term is called a cystocele. Are there specific exercises beyond Kegels that can help with this? Okay, so first of all, I would say, without examining you specifically, that you might think about, so first of all, in terms of pelvic floor strength, you might think about working on strengthening in a horizontal position. This position is going to be easier to do a contraction versus in an upright position. I would maybe start with this position. The other thing that sometimes can be helpful is to give yourself some like regular voiding. Sometimes I ask people to like put an alarm on their phone and say, make it go off every 2 hours, because overfilling of your bladder is only going to increase your symptoms. And the other thing you want to make sure is that you're actually completely emptying your bladder. So with cystocele, sometimes bladder can have a bit of change in position. And so then we don't always realize there may be more fluid there than what we think. So I always encourage people to really make sure that they're fully emptying their bladder. And one of the things that can be helpful is what I call lift and lean. So, so I'm standing up again, and if you are sitting on the potty, actually lifting might take some pressure off of the urethra and bladder, and then doing a bit of lean forward at the same time. Okay, next question. Okay, this is a question about pessary. I have been told that my uterus has detached and is pressing on my cervix, causing it to have some bulging and some descent. Is there anything I can do for this? Being told a pessary ring would help. So a pessary is it's actually coded as an orthotic, just like you have an orthotic in your shoes to support the ligaments in your foot. You can have a pessary, which looks like a ring or a donut. Some people feel like it looks like a diaphragm. Comes in a few different shapes and sizes, and that is really dependent on your anatomy. So a pessary ring, yes, can be helpful. You are fitted for it. So just like if you wear a size 8, then that's the size that you get fitted for. Sorry, I was thinking about shoes. But pessary is the same way. You get fitted for it in clinic, and this is by your OB-GYN. They'll fit you for it, and then they'll ask you to stand up and walk around a little bit and maybe jump a little bit. You want the pessary to stay. However, you also want to be able to pee. So I always tell folks, if you're going to go get fitted for pessary, drink something beforehand so that you have something to try and pee afterward, meaning afterward, like when you have it in. And then, as I said, you want to still be able to, you don't want it to like support you so much that you are not able to urinate. I have some people who wear pessary all the time, and then I have other people who only wear it when they go for a run. So kind of a wide range in terms of how you can utilize that. All right, someone wrote in, when I feel I need to urinate, I tend to panic, and will I make it to the bathroom in time? And what can I do to get to the toilet in time? So I had this myself in Germany, and that was the not being able to get to a bathroom, and then really being concerned about it afterward, like being concerned, like, oh, where is it going to be? So I think twofold. Number one, doing your strengthening exercises, doing your Kegel exercises, but the other is I call it talking myself down. So when I get that urge to go, and actually the only thing, every once in a while I will feel that again, and it will be with travel when I am not the person driving and I don't know where the next body stop is, even though we're in the US. So I think of doing my, like I said, I call it talking myself down, doing my good breathing to help calm. You're actually helping to calm the sympathetic nervous system, but that also helps calm the walls of the bladder. The walls of the bladder contract down when we get that panic and that urge to go, especially like, I was able to hold it for the last 2 hours, but I can't seem to hold it the last 10 seconds. That is bladder literally contracting down. And then there is physically less space for the fluid that's there, and we're not able to hold. That's your pelvic floor muscles helping you hold, and then we have loss. So number one, doing your pelvic floor exercises and strengthening. And then number two, doing your, so I call it my good breathing, meaning that I'm going to breathe into my chest and then into abdomen. And I would say sit if that is possible, because that tends to give you a bit more support. But if not, then you are standing, you are doing a contraction, and think about all the times that you have made it to the bathroom in time. And even though that sounds funny, it does help to kind of retrain that part of the brain that gets panicky or urgency with wondering, oh gosh, am I going to make it to the bathroom in time? You doing your exercises helps give you support from below, and then you calming your brain helps to, again, decrease that sympathetic nervous system response. The other thing I usually do for urinary urgency is to practice once a day when I'm at home. When you can tell that you need to go to the bathroom but you are not dire, go into your bathroom and delay. And you might delay just like 10 seconds to start. But delay meaning I'm going to do a contraction and I'm going to do my good breathing. And you can tell that you have to go, but you're not dire to go. So I might delay 10 seconds and then keep my control as I'm sitting down and then go. And gradually increase that time. All right. One person writes in that after urination, it feels like an air bubble, and then there will be more urine loss. So first thing I would think of is, you said after urination, I would actually give myself like an extra minute on the toilet. And then while you are there, you might try a few position changes. So a bit of leaning forward, but then also some leaning to the left or to the right side. Sometimes the bladder needs a little more time to contract down. You said you feel like an air bubble and then a little more urine. So sometimes urine can also be a bit caught in the urethra. And again, those position changes may help to have that urine release before getting off the toilet. And for some people, it's the action of the leaning forward and then the standing up, and it's the push with the standing up that kind of causes a little more to come down. So that's why I recommend trying to do some of that leaning to the side and forward while you're still on the potty and seeing if you can get that to come out. I've also had some people though who liked doing that lift and lean thing again, because it would take pressure off, the lift part takes pressure off of the urethra, and then they're able to fully empty. When is best time to see a women's health specialist? If you have questions or concerns, you can do like a quick visit, injury screen, or I'm also available by email as well. It's christina.lee@irgpt.com. Okay. So thank you so much, and glad it has been useful.